Hey, this is Dr. Matthew Mitchell, and in this video, we're going to walk through healthcare systems in the United States. We'll go through different parts of the healthcare system in the United States, providers, how healthcare is provided, how it's delivered, and we'll get into not just some of these aspects, but how these differ from other countries. And we'll see that in some other videos following this as well. So I think one of the things to grasp about the U.S. healthcare system is its simple scope. Because of the size of the United States, because of the number of providers, physicians, nurses, hospitals, and that doesn't even include, obviously, individuals who are seeking health care, not just through private insurance, but through Medicare and Medicaid. The scope of the healthcare system in the United States is far greater than most any other country in the world. Now, that doesn't make the system better or worse. It does make its dynamic a little bit different, though. And throw on top of that, some of the cultural and economic disparities in the United States, it makes a lot of challenges for the U.S. healthcare system that we don't necessarily see in other countries. And so one thing to grasp when we talk about healthcare systems is the role government will play. Now, we'll see in different countries that the role of government can be one as a provider, where they are the sole provider of insurance. They're paying for doctors and hospitals and nurses. In some countries, government isn't the provider, but they are the insurer. We see that in countries in some parts of Europe where hospitals are private and physicians are paid privately, but the government plays the role of the payer of insurance. And then we see in some countries like the United States and Germany to some extent where government has less of a role, where it's more private insurance, often through employers, that plays a key role. But regardless, though, government's always going to play a role. Whether that's through the primary provider, whether that's through regulating healthcare systems, which is key in the United States, or whether that is simply just providing funding for research and improving technology and regulating healthcare policy. And so the role of government is always a key topic, a key debate when it comes to healthcare systems. Now, in the United States, what we often see is a term called managed care, where because so much of healthcare provided in the United States is through private insurers, often healthcare is provided through MCOs, managed care organizations, where these attempt to function as both insurance and provider and at least have some control over the delivery system to provide healthcare, quality healthcare, to as many individuals as possible. Now, whether the system is successful or not, that's something we can debate, and we will in another video, but it does often guide what we see in the United States system. That's definitely a little different than what we see in other systems. Okay, so one thing to kind of grasp as far as the U.S. healthcare system goes is that there's a variety of sources of healthcare in the United States. And I will say, this is very different than most other countries. Most other countries, there is a pretty set system, whether it is single payer, like we see in the UK, whether it's more privatized, the Bismarck model, which we see in Germany. The US is a bit of a hodgepodge of a lot of systems where the vast majority of insured individuals is through private insurance, typically through an employer, and we'll talk about that. However, there, as you can see in this graph, there's Medicare, there's Medicaid, there is military through the VA, Veterans Association, hospitals and healthcare systems. And so it makes the U.S. a little bit different, and to say the U.S. is totally private is not true. There's a large aspect of government funding. And so it is a bit of a mix of a lot of different systems that we see. So let's look at these systems one by one. So one part of the healthcare system in the U.S. is private insurance, where private insurance is provided through someone's job, their employer. This dates back actually to World War II, where when post-World War II, healthcare started to become provided as something that could be paid for, that was actually through employers. It was a perk of employment. It was a way to get individuals to sign on for a job. Employers often provide health insurance as a benefit. Now, back then, the cost of health insurance was quite less than it is now. The system was quite less intricate, quite less involved, and so it wasn't that large of a cost. Well, fast forward decades later, it's a substantial cost. And so, some would say this aspect of the healthcare system is maybe outlived its usefulness, maybe. But it's still commonplace today where employers provide some aspect of healthcare. Now, no longer do employers pay for this 100%. There's now typically premiums that employees pay, or to some degree, and that goes up often every year. But this is often provided through the employer, and that's again about half of the insurance that we see in the United States. Now, that part is private. There are actually parts that are government funded or publicly funded. One is through Medicaid. So Medicaid is a taxpayer funded coverage that provides insurance and coverage for basic medical costs, hospital costs for individuals at a certain percentage of the federal poverty line, the FPL. Now, this is very much run state by state, and although this is a government funded program, it does vary state by state. So where that funding starts can vary. In some states, you can be a certain percentage over the FPL and still receive Medicaid. In some states, you have to be at the FPL. In some states, you have to be maybe 50% of the FPL. So that will vary. Generally, what these provisions are fairly commonplace in most states in regards to laboratory screenings, physician costs, x-rays, even preventative care, nursing home coverage. It does vary state by state, and that's definitely true. And in some states, states provide greater resources than the federal government provides, and there's typically payroll taxes that assist in providing this as well. And so this is going to pay for insurance for some number of Americans, usually about 30 or 40 million, who are considered can't be pay for this financially on their own. So that's Medicaid. Medicare is another aspect where this is for individuals who are over the age of 65. And Medicare is a very intricate system that we won't cover fully in this video, but it's divided into Part A, B, C, and D. Part A provides basic resources in regards to hospital plans, physician costs, things like that. That is solely covered under Medicare. Medicare Part B actually has a premium to it. It changes every year. It's about $170, or give or take, in 2023. This is going to cover physician services, other premiums, things like that. There's Part C. Part C is actually Medicare that's often bought by individuals over the age of 65 to pay for things that Medicare Part A and Part B don't cover. And this is where supplemental plans become really important. Part D covers prescription costs. And so you could say that here Medicare kind of steps in as in a way, a private insurer to a degree, providing some of those basic needs. And that's true to an extent. Individuals qualify for this as soon as they turn age 65. And there's a lot of policies in regards to what is and what isn't funded, when individuals can qualify for this that we won't get into. But this covers for obviously a substantial number of Americans through Social Security, taxes, and this has been controversial because as the U.S. population gets older and more people qualify for this, how does this part of the system maintain itself? And it's a very good debatable question. Another part of the healthcare system, which isn't talked about as much, but is a key part of it, is VA, or Veterans Health Administration. This is a government-run healthcare system that includes VA hospitals, VA clinics, VA outpatient, VA doctors, nurses, and healthcare staff that is specifically for military personnel, veterans as well. And this isn't simply covering costs of, healthcare needed because of injuries in the battlefield or anything like that. These are actually for all healthcare needs for former military veterans. And so that's a substantial amount. I think it's about 7-8% of the U.S. population. So not a small part, and this is fully government funded. In a lot of ways, the VA system is much like what we see in places like the UK, where the system is run by the government. The parties are paid by the government, doctors, nurses, staff, very much like we see in socialized healthcare in other parts of the world. And so each of these parts play a key role. And as you'll see, one of the debates that we'll see in other healthcare systems is this role of private and public, and what part of the system is publicly run, government insured, what part is private. And as we see here in the United States, it's a bit of a hodgepodge, right? That's not the case in a lot of other countries. In some countries, it is almost solely public. In some countries, like Germany, it's almost solely private. And so this balance between these two is often what's debated in regards to healthcare systems. Okay, so I hope this video hope to help to understand a little bit as far as U.S. healthcare system. And in future videos, we'll look at different countries and we'll deal with some of the issues in regards to healthcare costs and how to rein those in.